Hi, Kevin Henry, the Group Editorial Director for UBM Medica's Dental Division, and I'm on a Google Hangout today with one of the foremost thought leaders in dentistry and also my dear friend, Linda Miles. How are you this morning, Linda?
I'm great, Kevin. I hope you are.
I am. Thank you so much, and I really appreciate your time and appreciate your insight that you're getting ready to share with our viewers.
Great. Thank you so much for the invitation.
You know, I know you and I have talked a lot about how the dental team really makes or breaks a practice, and I know you believe that so strongly. So how do dentists keep their teams accountable and motivated to kind of go that extra mile and think of their profession as a career rather than just a job or just a paycheck until something better comes along?
Well, we see this a lot in today's world, and so many dental auxiliaries are coming into the profession. They're really undecided as a young person what they want to do for the rest of their life. And for the lifers like you and I, we've been in dentistry forever. So once it gets in your bloodstream, I think it's there. And I think that when dentists are hiring, they should look at attitude and they should look at the way people present themselves as far as their behavioral style. Will they fit in well with the team we've already assembled? And do they have a caring attitude? I believe in giving young auxiliaries a chance to come in and get the vibe of what it's like to be in dentistry and give them the tools. And aside from hiring properly, I think it's a leadership issue, Kevin. And, the older dentists are the matures. That's my age group. And we miss boomers by a few years. Your age group is the boomers, and we're into relationship building, the matures and the boomers. And the newer employers, the millenniums, the X and the Ys, they're really different leaders. And I think if you want your team to be accountable and motivated and excited about your practice and about dentistry, the leadership has to be very positive. And I see so many of the younger leaders that are back in their office working on their phone or their computer, and they're saying to their team members, I don't have meetings. If you need anything, text me. And it really is going to hurt the next generation of creating these accountable and these dependable and these motivated employees, because they're looking for a leader that is part of the team. And if I'm your employer and I don't seem excited about dentistry and I don't want to communicate with you and get you excited about how wonderful our team is and showing appreciation, I tell my clients and audiences, Kevin, that there are 4 words of empowerment. That is, hire them, train them, trust them, and praise them. It's so simple to do those 4 things in that order, because the dentist can't really praise someone's work if it's inferior, and they certainly can't expect them to just know and read my mind if I'm the employer. So communication is at the base of everything in leadership, in my opinion. And I think that if you have a great leader, they hire properly and look for the right people that are going to want to be part of this team and want to take care of patients. And I really believe if you put the patients first, everything else falls into place.
You know, you and I have talked that it's really not easy to be a dentist today. There's a lot going on. They're trying to take care of patients. They're trying to run their business. They're trying to keep their team moving in the right direction. And they're also trying to make sure that team's following their mission and their vision. So how's the best way for a dentist to really make sure that all this actually happens?
Well, they need to really look into hiring someone who knows more about the business side than they themselves. And, in dental school, they learn how to fix teeth. They don't learn how to hire and train the administrative team in particular. Clinical assisting and hygiene is more of a supervised position. And the hygienists have their schooling and they come out very well trained and very qualified. The assistants can go to dental assisting school or get great training on the job. But the dentist is sitting side by side supervising. And the very people that run this practice, and they have a tough job because they have to please the dentist who has overhead concerns and production requests. and they have to please the patient who wants in right now, and then they have to actually keep the clinical team on their side, because in every dental practice I've ever consulted, and I think there's more than 1,036 years, I have seen a division between the administrative team and the clinical team, whereas the clinical team believes that, you know, she sits up there all day rolling around on the chair, has the easiest job in the world, and we're back here. She creates the schedule. We have to take care of all these patients. And then the administrative team are thinking there's 6 of them, there's 2 of us, and everybody in the office thinks they have the hardest job of all. And actually, everyone has a difficult job. It isn't easy.
You're absolutely right. And, you know, and it really a lot of times boils down to people worrying about each other whenever you know, accountability is such a big thing. And sometimes it seems to come and go with the employees as well. So let's talk about accountability for just a minute.
Okay.
Is this what you see as kind of a generational issue, or can it happen to those veteran team members as well? You know, how do you see that?
I think that at any age, team members can lose the plug, as they say in Australia, and that is that they become less accountable. And one of the ways that I feel leaders and office managers can create this accountability, I was asked to do a TED Talk for ADPA. This was about 3 years ago, and I did some research, and there's a wonderful book called Reality-Based Leadership. And the author said that 70% of all employees are highly personally accountable. In other words, they want to do their very best every single day. 30% of the workplace are there just to draw a paycheck and just to do as much as they have to do to get by and keep the job. And when I share those numbers that Cy Wakeman, who is the author, her name is Cy Wakeman, and when I share the numbers that she shared in her book, Reality-Based Leadership, dentists say, well, I think the numbers might be different in my practice. I think 70% of mine are not accountable. But I look again at leadership. How strong is the leadership? And if you have great leadership, you're going to have highly accountable people on your team.
You know, and let's keep going with the accountability, because I hear that so much from dentists, and so do you as well. So what does improved accountability really do for that employee personally? And do you think that that accountability that they have in the workplace carries over to personal life as well?
I definitely do. I think that one of the best ways to create ongoing accountability, I think, which was one of your questions before, is that if you were my employer, Kevin, and you, Dr. Henry, asked me to clear up the accounts receivable, they're twice as much as the standard of keeping 1/2 of your monthly production on the books or less. And so if your accounts receivable are 2 times that amount or a full month of your production figures, and you hand me the job and say, I want you to work on this for 90 days, but if you as my employer or my office administrator, office manager doesn't check back with me, and in a couple of weeks, and Linda, how are the calls going? What has been your greatest obstacle? What can we provide that we haven't already provided to help you with this mission? So if no one in middle or upper management ever checks back with me, my accountability is going to last about 3 weeks to 3 months. And if nobody else cares about my results, why should I continue to care? So it's giving them a task, it's giving them the tools to complete the task, and then it's follow up, follow up, follow up. My former employer in the late 70s, if you can remember that far back, Kevin, you probably weren't born, but he was a born leader, and leadership wasn't even a topic back then. And every month, without fail, he and I spent 10 minutes. All it took was 10 minutes to go over the past due accounts and decide which ones needed to have more than a phone call. And he seemed interested. And because he was interested, I really wanted to do a better job each month because I knew he was going to check back. 10 minutes a month is not a lot of time. But he showed an interest in what his team members did. And he was that way with all four of us.
And showing an interest, I'm sure that helped you kind of be satisfied with what you were doing as well. So,
Right, right.
how does the dentist employer today really create that that higher level of satisfaction within his or her employee base?
Well, I really believe that you have to have team meetings. I think they're crucial. Definitely start the day with a positive and uplifting short 10 to 15-minute morning huddle. And I also believe in having personal reviews with your team members at various points of employment. If it's a new employee, they're scared to death. Even if they come in with experience, they need to have a buddy person, a buddy system that answers any questions. There are no dumb questions, because you really feel dumb when you go in as a new person, especially if you don't know how to turn on the microwave or something silly like that. And so the buddy tells me everything I need to know, and there are no dumb questions. And then I think that not only is the orientation and the buddy system important, I think it's real important to have a verbal review with that employee at the end of 30 days and have another one at 90 days. And I think that all employees, long-term employees, need to have performance reviews, not so much as evaluations as we used to call them, but a review. And a review is two ways, like how are you doing on this project that you've taken on, and is there anything we can provide that will help you along the path? What's your deadline for completing the steps of the project? And, just following up. Someone in middle management, and, office administrators or office managers have a key role in today's dental practice. And years ago, in the mid-'80s, I created a 2-day practice administration workshop, and I invited dentists, spouses of dentists, and the office manager to come, because the spouse of the doctor, whether they work there or never go near the office, they are the co-owner of that business. And so if something happens to that doctor, the spouse is actually in charge of transitioning the practice or whatever they need to do. So I think it's real important to have to outline what the role of the middle manager in this practice does. And usually the 4 key points, Kevin, that the office manager takes on is personnel, which the dentists are thrilled to pieces to hand over, because personnel is a very busy job in most practices, handling all the team requests for time off and making sure we're fully staffed and setting up training sessions for the team members and planning the once a year or twice a year continuing ed. There's a lot to do with personnel, interviewing, pre-interviewing. And the second part of their job is budget and finance. An office manager needs to know what the overhead numbers are and how to hit the target. And if it isn't hitting the target, what string to pull to make it land on that target. And that is, of course, decided upon by the doctor and office manager and their CPA. And then the third is facility and technology updates. So many dentists are so busy, they don't have time to review what's available. And the fourth one is they're in charge, or they're head of the marketing department. So if you don't have internal and external marketing going on consistently in the practice, the office manager serves as the director of this marketing committee and selects one clinical assistant, one hygienist, and one admin team member. And together, these people form the four-legged marketing stool, with the dentist, of course, overseeing and part of that committee. So I believe communication and setting up systems like this are just critical to keep the team highly excited and motivated. And, it bothers me that some dentists still don't believe in sharing numbers of their practice with their team. And it's kind of like, Kevin, if I were on a football team just playing my heart out, but I never knew the score, how excited would I be for a win?
Right.
You've got to share certain statistical data with your team in order for them to want to go to the next level.